Director for this organization, and Dr. Elena and her team for invitation. Today I want to talk to you role of gallium 68 PSMA PET-CT in prostate cancer. Location of primary tumor and initial staging of the prostate cancer, critical role for treatment planning. Metastasis is one of the major causes of morbidity and mortality. NCCN guideline defines 5 risk groups of prostate cancer patients, and the same guideline defines 5 risk groups again, and the European Urology Association of Urology guidelines define 3 different risk groups. And European guidelines define recommend at least 1 cross-sectional imaging studies for metastasis screening in intermediate and high-risk prostate cancer patients. CT may show the evidence of metastatic spread to pelvic lymph node, seminal vesicle invasion, and occasionally demonstrate the sclerotic deposits characteristics of the osseous metastasis from prostate adenocarcinoma. CT can give information about changes to anatomy rather than actual tumor involvement. Combination of morphological sequences plus functional imaging, multiparametric have been used together, multiparametric MRI, which was referred as multiparametric MRI and standardized interpretation system, PURAS, are being increasingly used for evaluation of local tumor extent, and it plays an important role in the detection of metastatic lymph nodes. The diagnostic performance of probiopsy MRI sensitivity is high, but moderately specificity, and extreme range of negative predictive values. In the last decade, multiparametric MRI has become the leading imaging modality in the primary detection and localization of prostate cancer. However, MRI, a major step forward, is limited by issues such as claustrophobia, cost, and field of view limited usually to the pelvis alone. Determining the overall extent of prostate cancer with whole body MRI has gained increasing interest. Bone scan is widely used method for the evaluation of bone metastasis, and NCCN guidelines define whose patients should be performed the bone scan. But both bone scan negative predictive value is very high. If the patient is asymptomatic, bone scan should be performed every stage. In particular, hybrid imaging methods is advanced imaging methods, including PET-CT and PET-MRI using different radiopharmaceuticals, have shown relevant results for early detection of local and systemic spread of prostate cancer. Metabolic information provided with PET, anatomic and morphologic correlation provided with CT or MRI in this technique. Many different radiopharmaceutical agents showing a tropism for prostate cancer cells have been introduced, such as choline, acetate, PSMA, and another. Choline and carbon-11 acetate seems a promising role in staging of high-risk prostate cancer. Choline is a phospholipid in human cell membranes, and it has shown increased expression in prostate cancer. They show a good performance in the therapy monitoring of patients with metastatic carcinoma. Choline had demonstrated higher accuracy than MRI for the detection of primary prostate cancer, is an important point. And sensitivity of collar remains inadequate when the PSA level decreased. Another radiopharmaceutical, we know that, and we apply many different cancer types. Fluorine 18 labels FDG PET scan. FDG PET is the most commonly used method in oncological patients. But PCA cells show low FDG affinity related with slow growth rate. FDG PET-CT has limited role for early stage prostate cancer, but important role in the castration-resistant prostate cancer and more aggressive subtypes of the prostate cancer. Lovell et al. Reported that maximum intraprostatic FDG uptake was statistically associated with a higher Gleason score, extracapsular extension, seminal vesicle invasion, and pathological lymph node metastasis. At this point, PSMA looked like a game changer. PSMA is a type 2 transmembrane glycoprotein at the prostate cell surface, and PSA cell overexpress PSMA. The level of PSMA expression rises with increasing tumor differentiation, as well as in metastatic and hormone-refractory prostate cancer. And it seems to be a PSMA ideal imaging and therapeutic target for prostate cancer. Several PSMA ligands, slightly different in the chemical structure, are commercially available for diagnosis and therapy prostate cancer. This molecule may be radiolabeled with different positron emitters, such as gallium-68, fluorine 819, or copper-64. Gallium-68 are the most used PSMA-based radiopharmaceutical in the worldwide. And several radiolabeled small molecule inhibitors of PSMA have been designed. The most widely used PET tracer is gallium-68 PSMA-11. Gallium-68 PSMA has a higher sensitivity and specificity than other FDA-approved radiopharmaceuticals. Its main advantage is the commercial availability of germanium-68 generator and gallium-68 half-life only 68 minutes. Gallium-68 PSMA had entered the clinical practice since 2012, and gallium-68 PSMA is more sensitive for recurrent prostate cancer with a low prostate-specific antigen level. Recurrent prostate cancer is a main indication for gallium-68 PSMA PET-CT application. The diagnostic accuracy of gallium-68 PSMA PET to determine lymph node staging of prostate cancer preoperative remains unclear. In the study, Rapper et al. Reported that high sensitivity, specificity, positive predictive value, and negative predictive value for gallium-68 PSMA primary diagnosis. And they are make histological maps related with histopathological results and match the PSMA PET-CT images with this histological map. And the existence of tumor with the specimen was mapped, and the gallium-68 distribution in the tumor compared with correctly parallel histological maps. And also, they report Sumax value related with local regional Gleason scores and reduction rate of gallium PET increases to parallel with the Gleason score. The systemic review was evaluated the diagnostic accuracy of gallium-68 PSMA for initial detection of prostate cancer patients with clinical or biochemical suspicious. 7 articles comprising 389 patients were included in the study. The results suggest that gallium-68 PSMA had a high diagnostic accuracy in the detection of clinically significant tumors with a full sensitivity and negative likelihood ratio. The present meta-analysis show a superior diagnostic performance over multiparametric MRI with a higher sensitivity and lower negative likelihood ratio for the initial diagnosis of prostate cancer. A major drawback is moderate specificity. Its use can avoid unnecessary biopsy in this population. Larger prospective study comparing with diagnostic performance with that of multiparametric MRI, the settings are urgently needed. Retrospective view of men who underwent gallium-68 PSMA and multiparametric MRI for primary prostate cancer before radical prostatectomy across 4 centers between 2015 and 2018. 205 men included in the study. They define pathological index tumor as the lesion with highest International Society of Urology practice, pathology guideline, and radical prostatectomy specimen pathology. Their primary outcomes were rates of accurate detection and localization of radical prostatectomy specimen, pathology index tumor using gallium-68 or MRI. The other study. Gallium-68 PSMA positron tomography for primary staging of high-risk prostate cancer is a systematic review. 12 studies were included, and 222 patients who underwent gallium-68 PSMA PET scanning for the purpose of primary staging. High variation in methodology and outcomes, such as sensitivity and specificity, was seen across all studies. Most studies demonstrating increased detection rate with respect to conventional imaging modalities. In another study from Turkey, 24 patients underwent both gallium-68 PSMA and multiparametric MRI before robotic laparoscopic radical prostatectomy. Histological results were defined for tumor localization, extraprostatic extension, invasion of seminal vesicles and bladder neck invasion, and regional lymph node dissection. Histopathological results were also correlated with imaging modalities. The same study, sensitivity, specificity, positive predictive value, negative predictive value, and accuracy for detection of extraprostatic extension and seminal vesicle invasion were higher for multiparametric MRI than gallium-68 PSMA, but gallium-68 PSMA had significant successful result for detection of lymph node metastasis for compare with MRI, but with bladder neck invasion detection, both modalities had some insufficient results. Gallium-68 PSMA PET had strong result for appropriate tumor localization in the gland. This slide shows us gallium-68 PSMA obtained 71 years old man, pre-operative PSA 19 nanogram milliliter. And maximum intensity projection images of pretreatment PET CT demonstrate primary tumor and metastatic lymph nodes. Sagittal fusion PET CT images with gross tumoral lesion and many metastatic lymph nodes in the pelvic region. And the other patient, intraprostatic tumor localization of 52 years old patient with prostate cancer. The risk of score is low, and PSA also. Axial MRI images demonstrated that tumor localization at the left posterolateral mid-gland, but axial fusion gallium-68 PSMA image demonstrated tumoral uptake bilaterally in mid-gland, and histopathological tumor was located bilaterally. Gallium-68 PSMA positron tomography is sometimes good performance MRI for primary tumor localization and extraction. We do what we do for primary staging, medium and high risk prostate cancer. We know that 15% of prostate cancer patients were found to lymph node invasion. Pelvic lymph node is the most reliable way to determine lymph node invasion, but this method is both invasive and extensive and have some complications such as lymphocell and lymphedema. Before performing pelvic lymph node dissection, routine use nomograms to predict the extent of lymph node invasion is necessary. According to nomograms, patients with serum prostate-specific antigen bigger than 10 nanograms per liter and Godesson score bigger 6 or stage 3 have a 5 to 65% risk of lymph node involvement, and estimated risk more than 5% should undergo extent pelvic lymph node dissection. Assessment of lymph node staging before surgery is important for the operating and patient prognosis. In this study, in this review, 10 studies from different countries and regions are included. Total 700 patients. The results show us two specificity and two sensitivity was recorded. In conclusion, gallium-68 PSMA PET is found to have strong performance in the diagnosis of medium high-risk prostate cancer, lymph node staging, due to its relatively excellent diagnostic accuracy. Another study show us sensitivity range from low to high, or overall specificity was high for the detection of lymph node metastasis in patients with diagnosed prostate cancer of intermediate and high-risk carcinoma. Biochemical recurrence is seen in 5 years after primary curative treatment in terms of prostate cancer patients, and accurate diagnosis type of recurrence is very important for treatment planning and patient management. The selection of treatment method is mainly against the presence or absence of metastasis. A salvage lymphadenectomy or targeted radiotherapy is indicated metastasis-free patient, and systemic chemotherapy is indicated metastasis-positive patient. Several imaging modalities, including CT, MRI, transrectal ultrasound, are used to identify the site of recurrence. Study with cross-sectional imaging, CT and MRI, or functional imaging with FDG, PET, CT have shown disappointing sensitivity rates. PET imaging using probes of lipid and amino acid metabolism has also been used successfully to detect recurrent disease and has shown